Good afternoon, ladies and gentlemen, nurses, midwives, wherever you are in the world. A very, very warm welcome to this, our third webinar with the World Health Organization and Nursing Now Global Solutions Initiative. You're very welcome to be joining us. I hope that you've had a good week. It's been a busy week for us. Wishing all midwives watching, listening today, a very happy International Day of the Midwife for yesterday. And to nurses, I hope you're planning a celebration for the 12th next Friday. We'll be thinking of everybody then as well. So as I say, a very warm welcome. We've been really pleased with the interest that we've had for this Global Solutions and really excited to see what you're all going to be doing with your projects, with your proposals as time goes by. We hope you've been working on them and thinking them through, and we hope that you're going to be able to submit an entry into the challenge. We've had over 600 people registered for our session, so another really, really great turnout, and delighted to see so many of you coming. We've got some fantastic speakers today, some really, really interesting initiatives to share with you. You'll remember that over the course of the last two webinars, we had our technical team from the World Health Organization talking about antimicrobial resistance, why it's such a global issue, what we need to be doing about it, and how we can be involved. So just as they're not with us today, but as you can see on our screen, we are delighted yet again to have Elizabeth Iro, the WHO Chief Nursing Officer. I'm going to go straight over to you, Elizabeth. You're going to give us a bit of a refresher and a reminder about what we've talked about in the last couple of sessions and why this issue is so critical for us to get involved in. So thank you very much, Elizabeth.
Thank you, Emily. Good morning, good afternoon, good evening, colleagues and friends. Once again, it is good to see you all, and thank you for joining us today. The third of our series on antimicrobial resistance. Before we hear more from our guest speakers, I thought I would remind you of some key facts about why we need to work so hard to combat the challenges facing us as a consequences of antimicrobial resistance. WHO has declared that AMR is one of the top 10 global public health threats facing humanity. Drug-resistant infections are affecting the lives of thousands worldwide. One child dies every 3 minutes from multi-drug resistant sepsis. 1.3 million deaths attributed to AMR per year. 28 million people living in poverty by 2050. And will cost the world $1 trillion in additional health costs by 2050. A sustainable global national One Health response is essential to tackle antimicrobial resistance and achieve sustainable development goals. This is why this is such an urgent and important issue. Every time we intervene to prevent the misuse or overuse of antibiotics, we are making an improvement. Every intervention brings us nearer to saving more lives and ensuring that medicines we depend on every day continue to work in the way that we need them to. We are running out of time, and I'm asking you for your support and vigilance in this area. Looking forward to the discussions today. Thank you very much.
Thank you, Elizabeth. Really, really important subject. Thank you for reminding us as to why we are here and why as nurses, we have a real commitment to do something important about this. So I'm going to introduce you to our first speaker now, and I'm delighted to introduce Monette Marinas. Monette is a clinical nurse specialist for infection prevention and control and antimicrobial stewardship lead nurse. She's the COVID-19 nurse, and she's the IPC nurse consultant, has lots and lots of titles and well worthy of every single one of them. She's an MSc in infection prevention of healthcare associated infections. Now, Monette's been working in the field of IPC for 14 years and building a really big infrastructure for IPC in a hospital in London. It's called the Royal Hospital for Neurodisability. It's a hospital for people with acquired brain injury. She leads a team of nurses there, engaging in them with antimicrobial stewardship since 2014. So I'm going to let her take over from here. She's a very special, fantastic nurse. Delighted you could join us, Monette. Thank you so much. Over to you.
Thank you, Emily. I'm very happy to be here, and I'm really glad that I could share what we have done and what we would plan to do in the coming years. I'll be presenting how we tackled antimicrobial resistance through infection prevention and control initiatives. Next slide, please. So I'm wishing to give you a little bit of a background on what we have done and demonstrate how infection prevention control has been applied and successfully help us in reducing the use of antimicrobial treatment in the hospital, and also highlight the importance of nurses in this journey. Next slide, please. Thank you. So I work for the Royal Hospital for Neurodisability. We are located in Southwest London. As you can see in the map, we are 8 minutes drive from Wimbledon tennis court. We have 240 bed capacity. We are not an acute hospital. So what it means for us is when our patient develops severe infection and require acute hospital management, we will have to transfer them out in our nearest acute hospital. We have 4 different services, and that includes long-term care. It's also known as nursing home, care home, residential home in other parts of the country. We have ventilator units, we have neuro rehab unit, and neurobehavioral unit. For this type of services, we have 2 different medical models. The long-term care facility is managed by our general practitioners. It's sort of a community type of delivery of care for the patients. And the other side of the hospital is through a hospital model led by our medical consultants. What it means is that because it's different now, we had 2 different medical pathways in terms of assessing and prescribing antimicrobials in the RHN before 2014. Next slide, please. So antimicrobial stewardship started almost a decade now. So in 2013, the UK set out 5-year strategy. It's the Start Smart Then Focus, which aims to reduce the use of antimicrobial drugs and also to stop it when it's not needed. In response to this strategy, the RHN IPC team, which I was leading at the time and still is, sorry, we wanted to add this antimicrobial stewardship in our clinical practice. So for us to do that, we developed a strategy. So we wanted to assess where we are in terms of this practice. We wanted to develop infrastructures and system to manage our gap in practice. And we would like to drive it in the clinical service and delivery of patient safe care. What we did in 2013 and 2014 is to assess our prescribing practices. The robust and extensive audit showed us that we can improve in terms of antimicrobial prescribing, we can improve in our assessment of patients and the delivery of infection management. Following that, we were able to develop a standard assessment procedure across the hospital and 1 antibiotic formulary. So even if we have 2 medical models, we are using 1 assessment process and 1 antimicrobial formulary, which has enhanced and improved our antimicrobial prescribing practices. To drive these changes, we use or change our focus in infection prevention and control practices. We are very fortunate to have clinical nurse specialists to help me drive this change in our hospital. Next slide, please. So to demonstrate the outcome of our strategy, you can see in this graph on the left-hand side, after the introduction of antimicrobial formulary, we managed to reduce antibiotic-related C. difficile infection in the hospital. Please note that the 2017 rise in cases is an outbreak episode, and we managed that very well as well. On the right side of the graph, in 2019, we introduced IV therapy and IV antibiotic treatments in RHN. The design is like the outpatient antibiotic therapy. So we assess our patient. If we can safely deliver their IV antibiotics in-house, we will. And you might notice that our bloodstream infection is gradually increasing from 2019 to 2021. The reason for that is we are managing patients who are unwell and can be safely treated on site. That gradual increase also signifies a gradual decline in our acute hospital treatment transfer. Sorry. I look back at our admissions and transfers for the last 3 years. We successfully reduced our acute hospital transfer related to infection up to almost 60%. So this is a very positive outcome in our patient group. Next slide, please. Monitoring systems are already in place. Since 2014, we have increased and robust screening of patients. We are now confident as nurses to hold off any antibiotic treatments, working with medical team, making sure that the patient is clinically stable, and we wait for the culture and sensitivity. And we have adopted as well the National Early Warning Score. It's a toolkit used in the UK. It determines or gives us a score in terms of the severity of illness of patient. It will help us prompt in critical management. And these two have helped our nurses in detecting and escalating early signs of sepsis. So this is really useful for us. We now have a monthly antibiotic rounds. So this is led by the IPC team. We have medical team, we have nurses here, we have clinicians, allied health professionals. So we come together every month, discuss our antimicrobial prescribing, how many are on antibiotics, IV antibiotics, are they appropriate? We challenge good practice and we highlight good practice in these meetings and rounds. Next slide, please. So these are our lovely clinical nurse specialists. And so since 2015, our team has grown. We have expert nurses in respiratory care, wound care, enteral, palliative, and continence nurse. Together with infection control, we were able to reduce the incidence of chest infection, catheter-associated infection, and wound infection. We were also able to push the ceiling of care in making sure that at the end of life pathway, unnecessary antimicrobial treatment are no longer prescribed. And we focus on comfort and the end of life pathway. Thank you. Next slide, please. So as we go to the road of recovery from COVID-19 and pandemic, it was a good time for us to reassess where we are in antimicrobial resistance problem and problem solving. The beginning of this year, we have sat down in IPC and say, what else can we do? It's a growing problem. It's a silent pandemic. How do we position ourselves in the next coming years? So we look at WHO strategy, the One Health approach. We look at the UK 20-year vision, which is to minimize, mitigate, and contain antimicrobial resistance. And we thought, we are not gonna let ourselves down because we have positive outcomes with our previous initiative. So what we will do in the next 2 years is we will continue to prevent infection and do more if we can. We will invest in clinical innovation so that we are able to minimize the use of antibiotics. So in terms of preventing infection, we will add emphasis on the prevention of infection, in the transmission of infection. We will engage our stakeholders in making sure that our medical devices, medical equipment will support IPC practices, meaning they will be amenable to cleaning, disinfection. We have in the next 5 years projects for new refurb and infrastructures. So IPC has taken the lead in early design, making sure that facilities like hand hygiene are accessible and located where they should be. We also in IPC team made sure that water safety and ventilation management is part of all of our infrastructures and designs. Having all of this together will enhance our prevention of infection actions. And we hope to achieve this every time and every day in RHN. Next slide, please. So clinical innovation is very important. It will also help us in infection prevention. At the moment, we're developing IPC champions. So we have one nurse associate who is receiving a formal training to become an IPC champion. For comparison, nurse associates are like your licensed practice nurse in the US, enrolled nurse in Australia. And I think they also have an equivalent in Canada. So they are not registered nurses, but they would have framework of responsibilities and job description as well. This program was piloted in our region and well received and acknowledged by the Southwest London Integrated Care Bureau. Just last week, we got the confirmation that we will be working with them, and we will develop 7 more IPC champions that will be working across Southwest London. This is really good initiative because we will be putting IPC at the heart of healthcare service. We also want that at the end of 2023, we will have an IT system that will capture and give us an live data on our antimicrobial practices, because it will capture assessment, treatment plans of patients. Next slide, please. So the success of prevention of infection and clinical innovation will also measure and give us a reflection of how we will use our antibiotics in the future. We would want to be in a position one day that we will only use antibiotics when it's clinically indicated. We will continue to do rescue treatment plans, but they're just rescue plans. We don't have to use it if we don't have a need for it. We will invest on education and training for antimicrobial stewardship with our new nurses, with our existing nurses. It has proven important to embed IPC in our staff and clinical clinicians. So one day we would like to have all of our staff as IPC champions and AMS champions. That is the dream, and we hope to achieve that in the next 14 to 18 months. Next slide, please. And that's it for me. Thank you for listening.
Emily, you're on mute.
Sorry about that. So yes, thank you, Monette. That was really a really great insight actually into how nurses have an opportunity to make a difference on the ground. And you can see from your data, just that bit of data about the fact that you've managed to stop patients going into acute care. And for your particular patient group, moving from one hospital to another is an incredibly stressful process for them. So I think that's something that's really valuable to directly affecting the impact of this on patients and for their families as well. So I really applaud you for that. I'm just going to ask you one question, actually, whilst we've got an audience here from across the world who may not have at their fingertips the resources that you have had. And I know, you know, we've talked in the past, you haven't got limitless resources, obviously, but how would you think it would be possible to replicate your strategy, your specialist nurses, to help drive infection prevention when you don't have an opportunity to have 6 or 7 specialist nurses to work with you?
Yeah, that's really a good question, Emily. I think what we started to do when we knew our problem is to look at the gap in our practice. So before getting the special nurses on my side, I didn't have them in mind, but we look at the problem. We look at our population health. The moment we identified the gap in our practice, we started building problem-solving measures, and they just fitted in. So I guess in areas where you don't have the same resources as ours, look around you and be creative. So if you have if the gap of practice is information delivery, awareness, start on that, and it will grow. Be creative. You may not have specialist nurses, but you will always have nurses who are willing to be your specialists or champions in your actions. I think it comes from an infectious enthusiasm, and I guess
you know, when you're leading, that's, you know, for me, this is your leadership clearly shining out to infuse and to explain to people why they need to be working. There's a question that's just appeared here from Victor. Thank you, Victor. Could you share your framework for AMR implementation in your facility? If that's, I mean, maybe that you want to share that, and we can post that with all the presentations and things at the end. So Victor, I'm sure we could get that to you and everyone can then share. Thank you very much, Monette. That was really great. I really appreciate you telling us about your experience. I'm going to move on now to our next speaker, Emilio Jimenez. Emilio is coming to us from Spain, an infection control nurse in the Belvich, I can't quite pronounce that. You may need to pronounce that for me, Victor, Emilio. Belvich University Hospital.
Belvich University Hospital.
Belvich, much better than me. I need to work on my Spanish accent. So you've been working there for a while in orthopedics, general surgery and infectious diseases from 2012 to 2016. So a lot of experience in this field. And then became part of the hospital infection control team as a reference for catheter-related bloodstream infections and the management of multi-drug resistant candidates. Member of the group of experts in vascular access of the Catalan Institute of Health, and since 2021, working on a PhD for medicine and translational research with the thesis focusing on the prevention of surgical site infection in patients undergoing craniotomy. So an interesting connection with Monette's hospital, actually, talking about craniotomies and brain injury. Welcome, Emilio. Thank you so much. I'll leave it to you, over to you to talk to us. Thank you.
Good afternoon, everyone. I'm going to share the screen. Okay. Before starting to present this work, I would like to thank the organization the opportunity they have given me to share our experience with you. As you said, my name is Emilio Jimenez, and I work as infection control nurse in the Belvich University Hospital. Today, I would like to talk about nurses and antimicrobial stewardship. What else can we do? I'm going to share the work that my team and I do. So to begin, what registered nurses can do? The role of nurses has already been well defined by CDC and EMA in 2017. First, nurses have to question the medical necessity of urine cultures. Second, they have to ensuring proper culturing techniques to guarantee the best diagnosis. Also, they have to initiate and switch from IV to PO antibiotics. Obtaining and recording an accurate penicillin drug allergy history is a nurse's role too. And finally, nurses have to start the antibiotic timeout at the time the physician has prescribed them. However, the competences of advanced practice nurses, registered nurses, do not always fit this model. So, what else advanced practice registered nurses can do? Focusing on patients, advanced practice nurses have to do surveillance in order to detect problems in the area of expertise. In addition, they must share the problems detected with the healthcare teams. Furthermore, all knowledge must be shared. Researching and publishing the results is the only way to make this information reach the whole world. So, as a infection control nurse, what did I do? Well, first, I have to detect hospital-acquired infection-related problems. Second, I have to identify antibiotic-resistant problems related to antibiotic overdose. And finally, I have to propose evidence-based solutions. Today, I would like to share our experience with you about how nurses can lead antimicrobial stewardship programs. This experience is about how the use of topical antibiotic prophylaxis can prevent surgical site infections in patients undergoing craniotomy. To give us a background, patients undergoing craniotomy in our center has high rates of surgical site infections. Median rates about 15%. Rates from clean surgery, as craniotomy is, ranges 3%. Moreover, the most prevalent causative agent was Cutibacterium acnes, commensal and part of the skin flora. So, a multidisciplinary team led by a nurse met to find a solution to this problem. This team consisted of a pharmacist, neurosurgical care nurses, infection control nurses, microbiologists, infectious disease MD, and neurosurgeons, and reviewing the most up-to-date clinical practice guidelines regarding preventive measures for surgical site care, conclude the importance to include topic antibiotic prophylaxis in subgaleal space prior to close of the skin. specifically 1 gram of vancomycin powder. Thanks to the implementation of this measure, the median rates of surgical site inspections decreased from 15 to 3%. Furthermore, with the implementation of the topical antibiotic prophylaxis, the hospital saved more than 500,000 euros a year preventing surgical site infection. The use of topical antibiotic prophylaxis is the main measure of a care bundle that includes all the steps of the surgical process. Other measures are appropriate hair removal with a single-use clipper in the preparative, and in the postoperative, surgical wound covered with a sterile absorbent drape the first 48 hours. As important as implementing preventive measures is sharing knowledge and experiences. 3 papers have been published and a doctoral thesis has been carried out thanks to this project. To conclude, World Health Organization has declared that antimicrobial resistance is one of the top 10 global public health threats facing humanity. Second, nurses have an important role in antimicrobial stewardship due to nurses' widespread involvement in activities that directly relate to antibiotic use. And finally, advanced priority registered nurses have the skills and knowledge to be a leading part of antimicrobial stewardship programs. I would like to finish with this sentence on slide 4 that said, quality means doing it right when no one is looking. Thank you so much for your attention. If you have any question, you have my email, my Twitter account. Thank you so much.
Thank you very much, Emilio. That was really interesting, actually, looking at the science and how you calculate the surgical site risk from different types of procedures. In all the measures that you implemented, topical antibiotic prophylaxis, did you feel that was the most effective?
In my opinion, of the measures is the most effective because the main causative agent was Cutibacterium agnes, a gram-positive bacterium. And vancomycin is a good treatment for this microorganism.
Thank you. And just in your view, you work in a big hospital now, and just comparing what you were saying about the nurse's role in antimicrobial stewardship, do you think that all the nurses that work with you in your hospital can contribute to that, to becoming antimicrobial stewards? And how would you go about training them? Monette's talked a little bit about how she's engaging with the workforce in her hospital. How would you approach that?
Well, in my opinion, all nurses have an active role in antimicrobial stewardship, regardless of the level of training. No? From questioning whether they need to switch from IV to PO or creating health policies. Anyway.
And at what part how would you start engaging with, say, a young early career nurse who's starting to work in the hospital? What would be the steps that you would take to bring them into the antimicrobial stewardship team, or to talk to them about it? What would you do? What would your advice be to them?
Can you repeat the question, please?
What would your advice be to a new nurse, an early career nurse who's joined your hospital, who wants to be involved in antimicrobial stewardship?
They have to be very creative. No, they have to questioning everything. They have to attack the rules because we have to do something because they have to do it now. Very, very critical. They have very critical.
Great. Thank you. Thank you very much indeed.
So much.
Okay. Thank you. And now we're going to move on to our third speaker, who's actually one of 3. So delighted to introduce to you Jo McEwen. Jo works in NHS Tayside, which is in Scotland, where she's been appointed as the UK's first advanced nurse practitioner in antimicrobial stewardship. So a fantastic accolade, Jo, leading light for antimicrobial stewardship in the UK. That's absolutely brilliant. Jo completed her undergraduate and postgraduate education at the University of Dundee and currently working as a senior clinical teacher, developing in the delivery of antimicrobial stewardship in both undergraduate and postgraduate nursing education. The first and current chair of the Scottish Antimicrobial Nursing Group. And that's something I think you're going to talk to us about this afternoon, Jo. So I'm going to hand straight over to you, and thank you very much for you and for your team. I know you're going to introduce your colleagues as you go forward. So thank you very much indeed.
Thank you, Emily, and extended thanks to the wider team for inviting us to share with you today the formation and function of the Scottish Antimicrobial Nursing Group. So bear with me just 2 seconds. So my slideshow wasn't working there. I'm have to. There we are now. Sorry, apologies for that. So as Emily alluded to, I'm delighted to have with me 2 other antimicrobial stewardship nurses who work within Scotland. So first of all, Jodie Allen, who is antimicrobial stewardship nurse specialist in NHS Grampian in Scotland, and Jane Walden, who's also an antimicrobial stewardship nurse in Dumfries and Galloway. So within Scotland, we are one of the 4 nations of the UK, and as a country, we only have 3 antimicrobial stewardship nurses, and Jane, Jodie and myself were the first three to be appointed in Scotland. So the Scottish Antimicrobial Nursing Group, we shorten it to SANG because within healthcare we love an abbreviation. So we first came together round about 2015 as professions, as nurses who were working within antimicrobial stewardship, and really at a time when within the literature there wasn't much direction to take us along the nursing antimicrobial stewardship route. So we formed the Scottish Antimicrobial Nursing Group as a peer support group, and we formalised this within 2017. So we are a professional nursing group for antimicrobial stewardship nurses or for nurses with a specialist interest in antimicrobial stewardship. We currently have a broad range of representation, which enriches the discussion and outputs and broadens the outreach of our outputs. So we have representation from Infection Prevention and Control, the Scottish Antimicrobial Prescribing Group, which is our strategic antimicrobial stewardship group within Scotland. We have representation from NHS Education Scotland and RHI Scotland, which is our overarching strategic healthcare associated infection group within Scotland. And more recently, we have recruited a member from the British Veterinary Nursing Association to promote our One Health agenda within Scotland and identify where within antimicrobial stewardship there are commonalities across nursing practice within both human and animal health. So although we took the decision to form an antimicrobial stewardship nursing group at a national level, this forum or forum could be replicated at any level. It could be replicated at the departmental level, organisational level, or regional level. And I think the key is to get nurses talking about antimicrobial stewardship and identifying where we as a profession can contribute to the antimicrobial stewardship and antimicrobial resistance agenda. So what do we do as SANG? Well, we are small in numbers, but we are mighty in what we do and what we can achieve. So our primary function is to translate both national and international antimicrobial stewardship agenda into the nursing and midwifery practice across Scotland. We want to raise the profile of antimicrobial stewardship and raise awareness of antimicrobial stewardship within the nursing and midwifery community. As the first nurses in antimicrobial stewardship in Scotland, we offer a significant degree of peer support for one another so that we can ensure that the direction we are taking nurses in antimicrobial stewardship is correct and is aligned to nursing and midwifery practice. We provide internal and external education. So as part of our meetings, we always include an internal CPD element within our quarterly meetings. And we also develop and deliver education for nurses in local boards or within university settings as well. We share the learning and experiences because each of us have a day-to-day job as an antimicrobial stewardship nurse, and we want to share that learning and quality improvement programmes that we are working on so that we can replicate and maximise opportunity across Scotland. We're a vehicle for sharing information, so any information, agendas or journal articles that are relevant to our area of practice, we use this as a fora to share that information. And last but not least, we're ambassadors for antimicrobial stewardship and always looking for opportunities where antimicrobial stewardship and nursing and midwifery practice can come together. One of the challenges we had when we established SANG was our governance structure. As there was no precedent for antimicrobial stewardship nursing, we needed to have collective support and ensure that we had accountability, responsibility, and a governance structure for reporting our activities within nursing and antimicrobial stewardship practice. So we work very closely and quite recently have a joint meeting quarterly with the antimicrobial the Association of Scottish Antimicrobial Pharmacists, and both of these groups, ourselves and SANG, are subgroups of the Scottish Antimicrobial Prescribing Group, which I mentioned earlier is our strategic antimicrobial stewardship group in Scotland. So our outputs of SANG to date are we developed and delivered nursing element within the SAPG, so Scottish Antimicrobial Prescribing Group, Fleming Fund project within Ghana. So Jodie had the opportunity to travel to Ghana to share experiences with nurses in two Ghanaian hospitals and observe and deliver education around antimicrobial stewardship nursing practice. We contributed as a group to the development and the review of NHS Education for Scotland resource raising awareness of antimicrobial stewardship for nurses and midwives. We have recently completed a benchmark survey exploring the antimicrobial stewardship content within our nursing and midwifery curriculum in both undergraduate and postgraduate education in Scotland. We've promoted the One Health agenda. We have antimicrobial stewardship nursing representation on all national subgroups where antimicrobial stewardship is discussed so that we can ensure that nurses are involved and included within that set agenda. We have an international collaborative exploring barriers and enablers to antimicrobial stewardship nursing practice, and we've contributed to the development of the undergraduate nursing antimicrobial stewardship framework. So as a small group, in not much time, I think you'll agree, it's quite a lot of achievement to date. So as I explained earlier on, Scotland is one of the 4 UK nations, and we have a devolved healthcare service. Scotland serves 5.5 million patients as a population, and we have 15 health boards within Scotland which serve the needs of those 5.5 million patients. As you can see, the health boards that are bold are the 3 geographical areas which have antimicrobial stewardship nurses. So as well as being members of SANG and key contributors to the Scottish Antimicrobial Nursing Group, we also have our day job as antimicrobial stewardship nurse practitioners. So I thought we would share some of the work that we carry out within our local boards as antimicrobial stewardship nurses. So within my board, I have a very close working relationship with our antimicrobial pharmacists, and we have forged a nurse pharmacist-led antimicrobial stewardship ward rounds. And this is quite a unique partnership when you look at the literature, a nurse and a pharmacist, and it's quite a powerful relationship as well. We're in the process of implementing hospital antibiotic review programme within one of our hospitals in NHS Tayside, which promotes the early adoption, conversion of IV to oral switch on antibiotics, and also looks at the total duration of antimicrobial prescriptions, two areas which we've already heard are key and critical to the role of the nurse, as nurses can prompt both IV to oral switch and duration of therapy through having clinical conversations with the wider multidisciplinary team. We're also about to embed penicillin allergy delabelling programme in one of our wards to look at ways that we can optimise antimicrobial therapy for our patients, infection outcomes for our patients, and look at reducing our length of stay where penicillin allergy has been recorded on patients' notes. We too are looking at the development of antimicrobial stewardship link nurse roles and currently recruited 20 link nurses across the surgical floor who will be key in delivering antimicrobial stewardship across these areas. We're also looking at the inclusion of antimicrobial stewardship within care home facilities. Is this becoming a key area of antimicrobial stewardship activity? As I mentioned earlier on, we deliver education both internally within our organisation and within the university settings. As a nurse, we contribute towards policy development and review and promoting nursing leadership within antimicrobial stewardship and acting as a key role model within antimicrobial stewardship. So I'm delighted to hand you over now to Jodie. So Jodie Allen, as I said, works in NHS Grampian and is an antimicrobial stewardship specialist nurse. Over to you, Jodie.
Thank you, Jo, for the introduction. As Jo said, my name is Jodie and I'm the AMS nurse specialist for NHS Grampian here in the northeast of Scotland. Grampian has a population of about 500,000 and spans over 3,000 square miles of cities, towns and rural landscape. My current role within NHS Grampian has evolved over many years and I now mainly focus on antimicrobial stewardship practices within the acute hospital setting. Clinical aspect of my role is ongoing development and service delivery of the bacteremia service. This is a nurse-led service where all patients with a Staph aureus bacteremia are reviewed and followed up by myself. This is a focus on appropriate management and treatment of SAB. I liaise closely with the microbiologist and the IPC team for each patient as required. The more educational aspect of my role is around AMS practices to all professional staff and patients on the prudent use of antimicrobials, also to the wider general public. I lead on and support QI projects, audit, policy and antibiotic guideline review at local and national level. Within my role, I'm a core member of the antimicrobial management team and represent the wider nursing workforce. A brief remit of this team is to continually improve antimicrobial usage, analysis of local antimicrobial data, promote education, application of antimicrobial guidelines, and also public engagement. I feel very fortunate to have my SAN colleagues. We are a great support professionally to one another, and the cumulative knowledge is a great resource to AMS and nursing, and I really do look forward to what we can achieve in stewardship in the future. Thank you.
Thank you, Jodie. And I'd like to hand you over to Jane Walden, who is an antimicrobial stewardship nurse in Dumfries and Galloway. Over to you, Jane.
Thank you, Jo, for introducing me. As you can see from my list of tasks that are carried out in Dumfries and Galloway, it's very similar to Jodie's and Jo's. I work in an acute hospital, which is Dumfries and Galloway Royal Infirmary, and we're very lucky in that we have electronic prescribing, which makes my job a lot easier. It's easier to audit. I get reports every day about what patients are on antibiotics, what antibiotics they're on, if they're on orals, whether they've got stop dates. So this makes my job a lot easier than the other girls who have still got Cardexes. But it enables me to do an orthopedic and a surgical ward round. So I prepare the documentation, and then myself and my team, which is a microbiologist, and an antimicrobial pharmacist, we go to the meetings and we discuss every patient that is on antibiotics on that day. And I've asked if we have to, we talk about duration, and we talk about any micro that might have been grown from samples, etc. So we feel that we're definitely getting the patient onto the right antibiotic at the right time. It's also helped me do quality improvement programs in the past. So I did an improvement project on missed doses of antibiotics. Because of electronic prescribing, I can see from my desk who is missing doses of the prescribed antibiotics. So it made it a lot easier to carry that quality improvement program out. Being a member of SAN has given me support in my post, and I think it's given nurses a bigger voice at national meetings when it comes to policy making and training, and it enables nurses to be an important part of improving the use of antibiotics in hospital and community settings. Thank you, Jo.
Thank you, Jane. So in summary, nurses have a significant role to play in antimicrobial stewardship. What we need is collective nursing leadership in antimicrobial stewardship. And that's not necessarily just at a local level, but we need that at national level and international level as well, which we are seeing through workshops such as this. There's strength in numbers, and whether it's 2 nurses or midwives speaking about antimicrobial stewardship or 22,000, the conversation is happening. So we need that to continue. Develop an antimicrobial stewardship nursing forum, if that's at departmental level, organisational, regional or national level. Again, having those conversations, identifying where we as a profession can contribute towards antimicrobial stewardship is critical. And more importantly, being part of that clinical conversation as part of the wider multidisciplinary team will make sure that all professions involved in antimicrobial stewardship has a role to play. So thank you for your opportunity, for this opportunity.
Thank you very much, Jo, Jodie and Jane. That was actually really, really interesting and really shows how the power of joined up working can really support and strengthen a whole program of work across an entire country. Really, really enlightening. Thank you. I love the point where you can look at your patient's antibiotics from your desk. Jen, I think that must have been really useful in the pandemic because so many people were trying to restrict access to patients and be able to review medicines and be able to act virtually is a, you know, it's a way of life that I think nurses need to embrace more. And that whole concept of telemedicine is not just a thing that medics can do, that nurses need to be involved in that as well. I was wanting to ask you, Jo, I think this is probably going to be directed at you. And bearing in mind, this is an audience of nurses in the first phases, their early careers. In your experiences, when you looked at the inclusion of antimicrobial stewardship in undergraduate and postgrad programs, what did you find, and how would you use those findings to embed the messages from antimicrobial stewardship in an early part of people's career?
So I think the message around antimicrobial stewardship in nursing and midwifery undergraduate and postgraduate practice is getting out there. When we first looked at antimicrobial stewardship inclusion in undergraduate programs, approximately 12% of higher education institutes had antimicrobial stewardship included in their undergraduate programs. However, when we looked at that more recently, 60% of those that responded had included antimicrobial stewardship within their undergraduate programs, which is encouraging in such a short space of time. And what it did highlight was that predominantly adult nursing programs had antimicrobial stewardship, whereas paediatrics, midwifery and mental health programs perhaps didn't. So that gives us an opportunity and an area to target our educational delivery moving forward.
Fascinating. Thank you very much. I've just seen a question from Dina in the chat here. And I think this is a really interesting question that a lot of people raise. Did you face any pushbacks from physician colleagues when you were embedding these? And I think, Monette, you probably might have had some thoughts on that as well. So perhaps, Jo, you could kick off, and then I'll go to Monette and see your experiences too of that, please.
So that is a wonderful question, and one that I was filled with absolute fear with when I came into this post, and perhaps overthought the challenges that I might have had around embedding antimicrobial stewardship or taking antimicrobial stewardship forward as a nurse. And I have to say, I have not to date encountered any challenges from other professions around my inclusion or broadening the inclusion of antimicrobial stewardship across nursing and midwifery, which I'm delighted to see, which I think perhaps reflects a generational and a cultural shift in terms of how we work in healthcare delivery as well. So I haven't. So
good, and long may that last.
Barrier.
Monette, do you want to add into that? Because I know you work very closely with your medical team, don't you? Your infection control specialists. You're muted. You might need to just undo your microphone.
Yes, thanks, Emily. Yeah, just like Jo, we didn't have any pushback. I think we started with developing trust, and our communication channels are always open. So there was no stepping on someone else's toes when we were doing. We always collaborate. We always ask for opinion, respect each other's opinion, and then agree to disagree sometimes. And so, yeah, we're very fortunate not to have that challenge in terms of antimicrobial stewardship practices.
I think a lot of it is around trust and credibility and professionalism. So that's good to hear too. Whilst we have Elizabeth on our panel today, Elizabeth, I'm going to come to you. I think, Jodie, I think it was you mentioned the need that we need to have an international and national campaign for leaders in this. And Elizabeth, I'd like to ask you a question from your global perspective as a global nursing leader. What do you think are the skills that young leaders need to address the issues of AMR, and how can we become competent leaders across the world? What would your advice be to early career nurses wanting to do this?
I think we've heard some of the some really good discussions around what these skill sets might be in the presentations today. I think really for me, it's about opportunities. We have opportunities as nurse leaders to change behavior, one through patient education. And of course, it's all about raising the awareness of the dangers of taking antibiotics unnecessarily. So it's also about opportunities to minimizing unnecessary prescribing. It is about needing good communication skills, data collection and evidence producing kind of skill sets, because all of this inform practice, which is vital. So I think really at the end of the day, I think the education and training in antimicrobial stewardship is really the key. It's really a focused approach to it. I think it's a kind of competencies that I'd like to kind of see that our nurse leaders in this area take forward. And I think, the classic example of, what we've just seen presented today, I think, because these nurse leaders who have presented today have been very competent and very systematic in their approach to taking forward antimicrobial stewardship. I think that's probably why the resistance from colleagues and teams around these organizations, that's probably the reason why. So I think this is just really saying that leaders exist, nursing leaders exist in all levels of our profession. So sorry if I've kind of elaborated a little bit beyond the question, Emily, but I think, as young nurse leaders, I think today's discussion is really definitely a way forward for them, setting them to take forward what they should be doing and the competencies that's required. So it's continuing education, isn't it? It's continuing training.
And I think what's come over loud and clear to me is that creating opportunities to gather good data so that you've got the tools to be able to show you can present your evidence. And we've seen evidence in all these presentations today of if you make an intervention, you make a difference, and then you can demonstrate that to people, and then that supports building up trust. So I think we've had some fantastic examples of how that works. I'm really, really grateful to all our speakers. Thank you, Elizabeth, for your comments as well. I think we've all learned a lot, and I hope it's been helpful for everybody else. I know I've really found it really interesting. Now, as we're coming to the end of our session, our third session, I just want to remind everybody of where we are with our challenge itself. I'm sure most of you have heard me say this before, but I'm going to say it again. Please don't just think about submitting a challenge to the Nursing Now initiative. Please actually do it. We won't change anything if we just think about it. Talk to your colleagues, get nurses talking. That was what Joe's message was, and I think that's a really good message. So talk about it, submit an application, because I think we all really do need to make a difference. We need to put our efforts into something, and this is just a golden opportunity to be able to have an initiative which can then have a global stage and be discussed at high levels. So I'm just going to remind everybody, the challenge itself, in your role as a nurse or a midwife, develop a solution that tackles misuse and overuse of antibiotics. We've seen some great examples of when that works really well today, when initiatives have made a big difference. So some ideas, I'm sure, have been brewing about how you might set up an initiative and submit it. So what you need to do now is, once you have your plan, you need to submit your plan by the latest to the Nursing Now challenge at the nursingnow.global, info@nursingnow.global. I think, Hannah, you might want to just pop that in the chat box, and then people can remind themselves of it. But no later than the 30th of May, very latest, close of play on the 30th. And after that, what we will do is the AMR team at the WHO with Nursing Now will review the entries. And then on the final session that we're going to host, which will be on June the 22nd, we're going to hear the presentations of the top 3 entries that the AMR team think have the best initiative that they would like to select. So what we will do at that point is we will be announcing the winner of this challenge. We're hoping that our Director General will be in the building and he will be able to announce that, which will be a really special moment. We hope you'll all join us to listen in to that session. So what happens then is that the person or team who are successful, firstly, the most important thing, will have a huge opportunity to contribute to the global health solutions for this. I mean, a real opportunity that doesn't come around very often. Nursing Now are going to donate $1,000 to support the solution to get it off the ground. So really supportive of that. Very excited that anybody would have some support financially to get things going. So that's really important. And then we're asking you as a winner, the winner will be invited to present their solution to the WHO experts, the senior team in AMR, and other experts in the nursing and midwifery departments who will have a real interest in supporting this project in every way they can to get it off the ground. So some really, really great opportunity for information, advice, and support to make a big change. We're then hoping that we will be able to support the writing up of this project to its conclusion in a journal, and we will help the winner to do that, to get a publication. And then we want to be able to invite them back to the Antimicrobial Awareness Week, which I think is normally in November. And we want you to be able to come and tell us how it's all going. So we really want to work with you to make this a really huge success. So it's a great opportunity, and I hope everybody listening today will think, okay, I'm going to go away and get my act together and submit an entry. So that's where we are today. I think, Elizabeth, I just wonder if you wanted to say any closing remarks just before we wind up for the end of the session.
Just very briefly, really, Emily, just to say how really pleasing to see the presentations today, and the fact that all nurses have a role to play in antimicrobial stewardship. And it's really great to see in all the presentations too about looking at the gaps with the surveillance and data collection to inform how best to address the situation, and especially through a quality improvement approach. It's been really vital. And raising the awareness on AMR and continually educating and training champions and ambassadors for AMR. It's so good to see. And to all of you who have joined our webinar, thank you for coming today. To our speakers, a special thank you for such excellent presentations. To everyone, please don't just think about a solution, please create one, implement it. We will not solve this if we as nurses do not play our part. So thank you very much for such an excellent day.
Thank you very much, everybody. And I'm really looking forward to seeing everyone again with some great, exciting session on June the 22nd. So thank you all and have a lovely weekend. Bye.